these are wonderful pictures of actually different types of hammer toes. So not all hammer toes are hammer toes. And you can see how by the drawings there, there's hammer toe, there's claw toe, there's curly toe, and there's mallet toe. Each of the joints within a toe, so there are 2 joints and 3 bones, and depending on where the pathology is, where the deformity is, we will then classify what type of quote unquote hammer toe. Hammer toes usually develop from contracture of tendons. The long tendons in the foot end up in the toes, to the toes, and attach to the different joints in the toes. And when these tendons, depending on whether they're tendons on the top of the foot or tendons on the bottom of the foot, depending on which tendon or tendons are involved, this will create different deformities. What we show here right above the diagrams is a picture of a gel sleeve. This is found in pretty much any good pharmacy or medical products facility, and it acts as a cushion. It does not take up that much room in the shoe. Most people do not find it bulky at all. Slide it over the toe, and it will help with protection of the shoe rubbing against the prominence of the bone that's part of the hammer toe deformity. So we take the toe and we try to straighten it with our hand, with our fingers. We try to straighten that toe. And does it reduce to normal? Then it's what we would call flexible. And many times with stretching that you do at home, stretching the toe, like you can stretch any muscle in the body, you can actually stress the tendons to the toes, stretch the tendons, and hopefully over time, and it's not going to happen in a day or a week or a month, but if you stretch those tendons, that deformity, let's say this, will not worsen. I'm not going to say necessarily that it'll be back to a normal, perfectly straight toe, but you will prevent the toe deformity from worsening. So very, very important in terms of a flexible deformity. Now, if it's a rigid deformity, then the rigidity is due to bone displacement or subluxation or arthritis. And arthritis can develop in the toes. And when the joints in the toes become arthritic, we then develop a rigid hammer toe or curly toe or claw toe deformity. You cannot correct it with stretching. And at that point, again, if it's a painful condition, very commonly hammer toes will cause corns to form, a corn or a callus on the top of the toe where the prominence is, at the end of the toe if you're walking on the end of the toe. And corns or calluses, whatever term you want to use, can become painful. They sometimes can ulcerate. That can cause a problem. Then we get infections, and we now enter a whole different realm for treatment of hammer toe. So protective sleeves, shoe with a wide, deep toe box. So when you go to an athletic shoe store, and there are several in Sarasota County, but you go to an athletic shoe store and you present and you tell the salespeople that you've got a bunion or a hammer toe, and you're looking for a shoe with a wide, deep toe box, there are certain shoes that fit that category, and typically the well-trained shoe salesmen in these stores understand deformities and will direct the patient, the customer at this point, to an appropriate shoe. The other thing you want to look for with shoes is the material of the shoe, the upper of the shoe, the part of the shoe that fits around the toes and the midfoot. You want that to be more of a nylon mesh material. Typically you'll see leather or canvas. Those will not help the condition. A nylon mesh upper will expand when you push against it. The material moves and will definitely lessen pressure against the toes.